Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I'm your host, Dr. Kishore Velody, and today's podcast is going to be one that I think hopefully will be really helpful to a lot of our listeners. In fact, I feel like I run into this almost on a daily basis in clinic where the child I'm seeing before me is either afraid or having a difficult time with either coming to the clinic visit or whatever comes after the clinic visit. And so I'm so glad to have Stephanie Colaberardino. I think I got your name right. Yes, on the podcast with me today from our Child Life Department here at Children's Hospital of Pittsburgh. And this is a podcast that we've been wanting to do for a really long time, and I've just kept forgetting to ask. And so I'm so glad to have Stephanie on the podcast with me today. Stephanie, why don't you tell our audience a little bit about who you are and what you do here at the hospital?
Sure. Well, thank you so much for inviting me to join you today.
Sure.
Like you said, my name is Stephanie Colaberardino. I am the director of the Child Life Department, as well as Volunteer Services and the Family Resource Center. I've been a certified child life specialist for over 20 years, and I've been the director of the department here at Children's for the last 8 years.
Wow. Okay. So tell me and our audience just what's a little bit more about, what is child life? What is it that you do and how you can help maybe perhaps even our kids will go through some specific scenarios as well.
Absolutely.
Yeah.
Thanks. Of course. Child life is a specialized field in the healthcare setting. It focuses on supporting the emotional and also developmental needs of children during medical experiences. So then a certified child life specialist, those are trained professionals who help children cope with the stress and anxiety that's associated with the healthcare setting. And they do that through preparation, developmentally appropriate education, distraction, play, and coping tools. They're really there to help promote emotional safety and minimizing not only the immediate, but also the long-term effects of the stress and psychosocial trauma.
That's great. I wasn't aware specifically of what goes into that certification. Can you
Mhm.
share that a little bit with us? Is this something that you get a degree in, or how does this work?
Absolutely. Yes. So most of our specialists are prepared at the master's level in child development or a related field. They've also completed a 600-hour internship under the supervision of a certified child specialist, and then are certified through the Association of Child Life Professionals.
Oh my goodness. Okay, so there's quite a bit of training that goes. It's
There
not just
is.
I love working with kids. It's a
That's
little
right.
bit more than that. It
It
seems.
is
My
a little bit
goodness.
more than that. It
Wow,
really
that's
is.
and I have definitely personally experienced in it with my own children. Really, what I used to tell my wife, it's like the magic of
Yeah.
the child life, where my one of my kids especially, I'm not going to call her out on the podcast, would get extremely worried anytime she would need to have any labs or go to see a doctor, and then we would have child life come, and it was like something magical had just happened in that room. And so I wanted to get your sense of what are some of the things that a child life specialist will use, like some general techniques to help kids when they're going through any kind of procedure related to their hospital stay or outpatient visit or something like that.
Sure. I think the best way to answer that question is a child life specialist is going to approach any child really based on where they are developmentally. So if we think through developmental aspects of hospitalization, starting with infants, that infant stage, we're considering stranger anxiety, mistrust, overstimulation of the environment, coming from home into this environment. Those are all going to be added stressors. So a child life specialist may work with that caregiver and look for opportunities to involve the caregiver in the tester procedure. Is it safe for the caregiver to continue to hold their child in a comforting way, maybe even if it's just during the exam? Working with the medical team to make sure the room, the environment is as quiet and calm as possible. We know going bouncing from rooms to room, we might be upbeat with the 3-year-old, but we have to kind of change that up when we go into the room with an infant because that's what that child needs and would benefit from. We're looking at comfort measures. Is there anything from home? Maybe asking the parent continue to talk to their child. That's a familiar voice to them. And always working with the medical team for other comfort measures, such as maybe sweeties, dipping a pacifier in sweeties, if that's appropriate for what we're doing to help with comfort. Toddlers still looking at that stranger anxiety, but this is that stage 2 where we're looking at loss of autonomy and control. Toddlers are that age group where now all that gross motor is starting to develop and they're walking and maybe running. And then they come to the hospital and all those things they were being applauded for and rewarded for, don't do that. Sit still. stay in the bed.
Yeah.
That's very, very confusing for them. So with toddlers, first step, making sure the caregiver knows what to expect. If we want them to help comfort their child, first and foremost, they need to know what is coming their way so they can care for their child first. They know their kids the best. Even in the toddler stage, looking for ways they can participate. Simple blood draw. If we're going to use a tourniquet, let them touch the tourniquet. Let's start to desensitize them. Let them touch it, play with it a little bit. We want to avoid covering their faces. And that might sound a little weird, but I think we think we're shielding them from something we don't want them to see. We are all strangers to them still here.
Mm-hmm.
So sometimes that's helpful. And that will raise anxiety if we're trying to shield what we don't want them to see and to let them have that autonomy to look around. In very simple terms, describing steps to procedures in terms of the senses. What are we going to see? What are we going to feel? Is something going to be a little cold? Is something going to be a warm sensation to get them prepared for what they're going to experience? We always tell parents if there's a comfort item to bring that with them. We might say, hey, if there's anything you don't feel or like, hold on to that comfort item, give it a good squeeze, or maybe we might utilize a stress ball at some point. For preschoolers, imaginations are running wild at this age. Misconceptions can certainly come into play, and we're also looking at that lack of control. This is a group that we're really doing some preparation with, developmentally age-appropriate preparation. That might involve some teaching tools, whether it's preparation books with pictures of each stage of something we're going to go through. It could be a teddy bear or doll that maybe we're putting an IV or doing a blood draw on to work through those steps so that kids can ask questions and also know what to expect. This is a stage we want to put together the why. A 3-year-old coming in with abdominal pain and getting an IV in their arm doesn't make any sense to them. My stomach hurts. Why are you hurting my arm? Mm-hmm. We want to work with them to help understand why we're doing the things we're doing using very simple language. Debriefing with this age group too. After it was over, how'd that go for you? What did you think? Is there anything we can do differently next time? Coaching through with coping techniques. We always want to make a plan with kids, and especially at the preschool age, we try to stay away from the things that they can't do and talk about the things they can do. So instead of saying, stay still and take some deep breaths, we might say, hey, you got a big, important job here. We all have a job here, right? Your job is going to be able is to stay as still as you can, but let's think of through some things you can move, looking for choices. Do you think it would be okay if we blink our eyes and we'll blink our eyes and see if our bodies are moving? That would be a great thing. You can blink your eyes as much as you want. Can you wiggle your toes in your shoes? Looking for really simple things to empower kids in moments when they feel that there's no choices there. We might bring in bubbles or pinwheels, whistles. Remember, instead of saying, let's take big, deep breaths, maybe we want to blow bubbles or pinwheels because that's familiar to them. Something they identify as, I know what to do with that already, rather than stay still and take deep breaths. Just reframing language that helps make sense to them. Again, letting them know why we're doing what we're doing. At preschool age, if we're drawing blood and they see blood coming out of their body, it's not uncommon for that age group to think you're taking all of their blood. Why would you do that to me? Explaining your body makes new blood and that they're safe. That school age, they're really afraid of pain, separation from school and their peers and their routine. Here with school age, we can start to prepare them a few days before they come in. Or that preschool age, we want to start talking about what they're going to experience closer to the actual event. School age, we can start a few days out and give them time to process and ask questions of their own. It might be things that we're not thinking of that are really important to them. So again, same with giving choices, but just make sure the choices are real choices. We never want to go into that situation and say, hey, are you ready for your blood draw yet? The answer is always going to be no. Sure. Just those real choices of what they can do. We want to look at types of distraction, relaxation, imagery, but distraction shouldn't be confused with tricks. We never want to trick kids. And sometimes I think that word gets misused with distraction. It's making sure the child knows what's going to happen, but looking for maybe positive refocusing of what else can you do during this? We already know what's taking place, but maybe you want to look at your favorite show on an iPad. Or what's your favorite song? You can put that on if you'd like to give you something else to think about. But it's not so much a trick versus what's going to work best for you in this
Yeah.
moment, especially at this age. And we really say the same for adolescents as well. Staying away from saying it's okay if the child seems upset. To that child, it might not be okay. And we're really just kind of diminishing their feelings on something, validating, saying, this is tough, but trying to point out something that they're doing well. I can see
Mm,
this is really hard. And even if it's not going great, thank you for letting us know how you're feeling. Something that is showing them, I see you and I hear you. And it might not be okay, but you are safe. That's something we try to reframe a lot when it's so easy to want to spit out, it's okay, it's okay. But to think in times where I want to say that, I can see you're struggling, you are safe. You are in a
mm,
safe place. Everyone
mhm.
is here to help you. It's changing that language a little bit.
Yeah.
And then finally, with our adolescents, just keeping in mind they are still growing emotionally, cognitively, behaviorally, and we don't want to assume that they know everything. This could be their first hospitalization experience. Sometimes we mistakenly assume that adolescents who aren't asking questions are fine. And often they're the ones that have the most questions.
Mm,
So, looking for opportunities to engage them in what's happening. Do you have questions? Do you want to write them down? Sometimes adolescents don't want to share what's really on their mind, and it's more helpful for them to write them down and share them with us later and going back to debriefing.
yeah.
Those are just some very
That's
general tips
great.
that we would do looking through those different developmental stages.
I love that. It seems like a lot of focus on preparation and also empowerment, because
Mhm.
coming into a hospital setting for any reason or a clinic setting is a loss of power for that child at any age. And so giving them ways that they can still have power and exert that in whatever ways are still helpful for that situation. So that's wonderful. I guess I'm thinking about just even some specific, it's even just some I saw within the last few days, a 5, 6 year old. We're having a great time, during the history
Yeah.
part of the visit where I'm just getting information from them and from
Yeah.
their parent. And then the moment I stop talking and I push the computer over to the side and get my stethoscope out, the crying begins. And so what are some techniques that maybe for the parent or that child, or even for me as the doctor, that might help that situation progress a little more smoothly?
Sure. I think before even coming into the hospital, setting the stage of what are we doing that day. So when
Hmm.
you push that computer aside, does the caregiver know what to expect that day? Are there procedures? Is it an exam? So that we can set that stage before they even get here.
Hmm.
And then it's just a matter of that repetition. Remember, we talked about this is what's going to happen today. Would you like me to take a second just to go over the next two things? And we can put it in smaller increments. The next
Hmm.
two things that we're going to do, we'll pause and we'll talk about the next two things just to kind of take it down and let them know, I can see you're upset. Let's take this in smaller increments if we can.
Yeah. And for a lot of our patients with Down syndrome, they tend to be really visual learners, and so I often will tell families, if there's a way that we can, via pictures, start to
Mhm.
prepare them for a visit, whether it's showing them a picture of the hospital or the clinic room or of me or whatever doctor they're seeing. Is that some techniques that you guys will use as well?
Absolutely. That's fantastic advice, especially pictures of the providers and
Yeah.
physicians and nurses. We have pictures ahead of time. That's fantastic that they're going to be able to put that together.
Yeah.
If you visit the child life section of the UPMC Children's website,
Mhm.
we also do have some of our preparation materials on that website that you can access right on there. So ahead of time coming in, you will see some pictures of various tests and procedures, different rooms you'll experience, as well as the hospital that can be
Oh,
helpful.
that's great. That's super helpful. And I'll definitely include that in the show notes for our listeners as well.
Right.
That's fantastic. Now, in terms of things that are often associated with my visit at the Down syndrome clinic is going to be lab draws. Often they'll need an annual lab draw as just part of their preventative health care. And a lot of the times, unfortunately, as the kids get older, they start to associate the visit with me with I'm going to get stuck with a needle. And so you mentioned some things, but what would be some specifically if there's a lot of lab phobia? Specifically, if you wouldn't even mind addressing the fact that sometimes parents won't they'll think they're doing the right thing by not mentioning the lab draw to the child before the visit ends. I'll say, okay, now next step will be the lab draw, and they'll say, oh, don't talk about that. What would be your approach to that as a child life specialist?
Again, it is developmentally based. So if it is a preschool, they're operating in the preschool stage of development, we could mention it before, but I would do that coming into the hospital. Again, school age, maybe a few days out, letting them know this is going to happen.
Hmm.
Those are not one of the choices. We are going to the hospital. We are going to have an exam.
Hmm.
Here's what the exam's going to look like. And then we're going to get labs done.
Hmm.
Depending on the age, why are we getting labs done? That's
Hmm.
pretty important too. Why do they need to have this information? Why do I need this poke? Coupling the why is very important.
Okay.
Now that we know why it's going to happen, how are we going to get through it? Let's talk about that. We know that we can get this done pretty quickly if we're able to stay as still as we can. But again, it's that coping plan. What can we do empowering
Yeah.
that child? Whether it is bubble blowing, just are we going to watch a movie? Are we going to
Mm.
listen to music? Another really helpful technique, especially at the preschool and younger school age, is comfort positioning. So that is a nice comfort hold with the caregiver. Sometimes it's chest to chest. Sometimes the child is formed with their back to the chest. So the caregiver is never asked to hold the child down, but instead give them almost a nice tight hug where the child
Mm.
is in safe arms, feeling comforted by their caregiver. And then medical professionals can hold the arm and get the labs done. That is extremely helpful. And I believe that is also on our website. It looks like a poster of all different types of comfort holds
Ah.
that parents can try even at home. And that's great preparation before coming in to
Oh,
try out
that's
the hold.
fantastic. Yeah, definitely. Okay, great, great. Another thing that kids will have oftentimes is, will end up they need to be sent for a sleep study to get
Mhm.
their to check for sleep apnea. Um, and those are usually not very happy times for either the child or for the parent. Not because there's anything sharp or painful, but it's just all the stickers and wires, and a lot of our patients tend to have a lot of facial sensitivities, and so it's not a pleasant experience for them. What are some things that you guys may have that could help somebody in preparation of a child for a sleep study?
Sure. I would encourage any family who is scheduled to have a sleep study with their child to reach out to Child Life. We do have a preparation book that we will be happy to send to anyone to go through with your child. And if you needed further support, we could have someone reach out to you and talk through that in a little bit more detail to help you plan for your visit.
Oh, that's great. That's great. And often after the sleep study, we'll discover that they have sleep apnea. Over 80% of our patients will. And then they're going to end up needing to go into the hospital and have their tonsils and adenoids removed. So pretty major surgery. So what are
Sure.
some things that maybe Child Life might be able to help with when it comes to preparing for the surgery, but also post-operatively recovering after the surgery with a sore throat and difficult
Mhm.
drinking and things like that?
Sure. So we do have two child life specialists in our same day surgery area. Whenever a caregiver is making that or scheduling that same day surgery date, they are contacted through a scheduler and there's a bit of an intake form. Some of those questions will lend to a child life specialist consult. They'll ask the questions about if their child needs any additional support. The child life specialist can send our preparation book ahead of time. And in some cases, we can even make calls before they come in. Regardless, when that child comes into same day surgery, we do have two specialists on staff that are rounding and meeting all those kids every day and helping to make sure that each step they're as comfortable as possible from height and weight until the time they go down to the OR. Just making sure that they are prepared they'll practice with the anesthesia mask. We'll let them practice with that. They're able to put chapstick inside the anesthesia mask to practice what scent they get to pick which scent they want of the chapstick and practice which one they would like to smell for anesthesia. Again, empowering them and really desensitizing them from some of the tools and equipment that they're going to see.
That's wonderful. Wow. If a family wanted to access some of these services for any of these things that we were talking about, or maybe even things that I didn't even think about, maybe helpful to have Child Life available or resources available, what would they do, especially for our patients when they have a developmental disability many times? What are some things that they can do in order to get Child Life assistance here at the hospital?
Sure. So from home, on our website, we do have our contact information. All of our specialists are there. You can actually reach out to the child life specialist in the area if you know ahead of time where you're going, like same-day surgery. Now, if you feel your child may benefit from more support than those techniques that I went over before, they may benefit from what we call our ACT program. That is an adaptive care plan. And what that is an individualized plan for your child that is created through an informal assessment. So a child life specialist would contact you at home and do some informal interviewing. They want to know the preferred communication style of your child, any sensory differences, and past medical experiences. There is criteria for this program that includes the child must be 3 years or older, diagnosed or being evaluated for a developmental disability or behavioral condition, and demonstrating a difficult time coping and cooperating in the hospital. If you answer yes to those questions, on our website, you will see a service account called CHP Adaptive Care. All you need to do is email that service account, and a child life specialist will contact you to go through that informal assessment. It's a caregiver opt-in program. If you feel that your child would benefit, we will work one-on-one with you to create that. That plan then goes into the medical record so that not just child life, but all the providers can see what do we need to do to help make sure that this experience, we're really minimizing the specific stressors for your child while they're here. So that is available as well.
That is absolutely amazing. Wow, I love that. And I think that there are perhaps a lot of people listening to the podcast here who would probably benefit from that service here locally at Children's. We've had some families that have had such difficult times with their kids that many times they've wondered, do we need to give them a sedative before they come to the hospital and things like that? But boy, wouldn't it be wonderful if this type of approach that we've been talking about today on the podcast would be helpful with a whole lot less side effects potentials in that too. So great. So before we close this podcast, are there any other things that you want to make sure that our listeners know about, or any kind of summary that you would want to give them of the things that we talked about today?
Well, I thank you for the opportunity to talk
Yeah.
about child life, the adaptive care plan. I think the message that I would like to send is we do have child life specialists in all areas of the hospital. So please, whenever you're here, ask for a child life specialist. We are accessible, especially throughout the day. We're even in the emergency department until midnight. So please don't ever hesitate if one does not come to your room right away, or maybe you just didn't cross paths with one. You can always ask for a child specialist, and all units have the contacts for them that they're able to reach and get you that support that you need.
Wonderful. Well, thank you so much again, Stephanie, for joining me on the podcast today.
No, thank you for having me. I really appreciate it.
And for our listeners, actually, I forgot to mention at the beginning of this podcast, this was a listener question that came. And so to our listeners, thank you so much for your engagement over the years that we've been doing this podcast. And you can always send me an email at downsyndromecenter@chp.edu with any topics that you would like us to cover, like this one, that is covered because of one of your requests. And also, if you would like to join us in the work that we do here at the hospital, including this podcast, please go to givetochildrens.org/Down Syndrome Center. But until next time, bye-bye.